Hi, everyone. This is Nurse Anna from nursestudy.net. And now that summer is over, we're going to start shortening the test. Tonight, we're just going to do preeclampsia and eclampsia NCLEX nursing questions with answers and rationales. Enjoy. And if you would like one of our free audio books with NCLEX questions on ACX or Audible, the links are in the description below. Enjoy the questions.
Question 1. A 28-year-old pregnant patient at 32 weeks gestation presents to the ER with severe headache, visual disturbances, and epigastric pain. Her blood pressure is 170/110 millimeters of mercury. What is the nurse's immediate priority? A. Administer antihypertensive medication. B. Monitor fetal heart rate. C. Prepare for delivery. D. Initiate seizure precautions. Answer, D. Initiate seizure precautions. Rationale: the patient's symptoms suggest severe preeclampsia, which can progress to eclampsia. Initiating seizure precautions is the immediate priority to protect the patient from potential seizures. Question 2. Which laboratory finding would the nurse expect in a patient with severe preeclampsia? A. Decreased liver enzymes. B. Increased platelet count. C. Elevated serum creatinine. D. Hypoglycemia. Answer, C. Elevated serum creatinine. Rationale: elevated serum creatinine indicates kidney dysfunction, which is a common finding in severe preeclampsia due to impaired renal perfusion. Question 3. During a prenatal visit, a patient at 28 weeks gestation reports a sudden increase in weight and swelling in her hands and face. What should the nurse assess first? A. Fetal movement. B. Urine output. C. Blood pressure. D. Fundal height. Answer, C. Blood pressure. Rationale: sudden weight gain and swelling are indicative of preeclampsia. Blood pressure should be assessed first to evaluate for hypertension. Question 4. A patient diagnosed with preeclampsia is receiving magnesium sulfate. What is the most important nursing assessment to monitor for magnesium toxicity? A. Deep tendon reflexes. B. Blood pressure. C. Urine output. D. Respiratory rate. Answer, A. Deep tendon reflexes. Rationale: monitoring deep tendon reflexes is crucial in patients receiving magnesium sulfate to detect early signs of toxicity, such as hyporeflexia. Question 5. A patient with preeclampsia is being managed with antihypertensive therapy. Which medication is commonly used for acute blood pressure control in this condition? A. Labetalol. B. Metoprolol. C. Furosemide. D. Digoxin. Answer, A. Labetalol. Rationale: labetalol is commonly used to manage acute hypertension in preeclampsia due to its effectiveness and safety profile in pregnancy. Question 6. Which of the following symptoms would indicate that preeclampsia has progressed to eclampsia? A. Severe headache. B. Visual disturbances. C. Proteinuria. D. Generalized tonic-clonic seizures. Answer, D. Generalized tonic-clonic seizures. Rationale: eclampsia is characterized by the onset of seizures in a patient with preeclampsia, marking the progression of the disease. Question 7. A patient with severe preeclampsia is admitted to the labor and delivery unit. What nursing intervention should be prioritized to prevent complications? A. Administering diuretics. B. Restricting fluid intake. C. Continuous fetal monitoring. D. Encouraging ambulation. Answer, C. Continuous fetal monitoring. Rationale: Continuous fetal monitoring is crucial to assess fetal well-being and detect any signs of distress due to the compromised maternal condition. Question 8. In the management of a patient with eclampsia, which medication is administered to prevent further seizures? A. Phenytoin. B. Magnesium sulfate. C. Diazepam. D. Lorazepam. Answer: B. Magnesium sulfate. Rationale: magnesium sulfate is the drug of choice for preventing and controlling seizures in patients with eclampsia. Question 9. A patient with preeclampsia is receiving magnesium sulfate. Which sign indicates that the medication is effective? A. Increased urine output. B. Absence of headache. C. Normal deep tendon reflexes. D. Stable blood pressure. Answer: C. Normal deep tendon reflexes. Rationale: normal deep tendon reflexes indicate that the patient is receiving an appropriate dose of magnesium sulfate without signs of toxicity, suggesting the medication's effectiveness. Question 10. A nurse is educating a patient with preeclampsia on lifestyle modifications. Which recommendation should be included? A. Increase sodium intake. B. Bed rest in the left lateral position. C. Engage in vigorous exercise. D. Limit fluid intake to 500 milliliters per day. Answer: B. Bed rest in the left lateral position. Rationale: bed rest in the left lateral position improves blood flow to the placenta and reduces pressure on the inferior vena cava, beneficial in managing preeclampsia. Question 11. Which diagnostic test is most indicative of worsening preeclampsia? A. Serum bilirubin. B. Serum uric acid. C. Complete blood count. D. 24-hour urine protein. Answer: D. 24-hour urine protein. Rationale: an increase in 24-hour urine protein levels is indicative of worsening renal involvement and disease progression in preeclampsia. Question 12. A patient with preeclampsia reports right upper quadrant pain. What potential complication should the nurse suspect? A. Placental abruption. B. HELP syndrome. C. Acute fatty liver of pregnancy. D. Gastroesophageal reflux disease. Answer: B. HELP syndrome. Rationale: right upper quadrant pain in a patient with preeclampsia can indicate HELLP syndrome, a severe complication involving hemolysis, elevated liver enzymes, and low platelets. Question 13. A patient with eclampsia has been stabilized after a seizure. What is the nurse's next priority? A. Obtain an electrocardiogram. B. Check deep tendon reflexes. C. Assess fetal status. D. Administer antihypertensive medication. Answer: C. Assess fetal status. Rationale: after stabilizing the patient, assessing fetal status is critical to ensure the well-being of the fetus following the seizure. Question 14. Which nursing diagnosis is most appropriate for a patient with severe preeclampsia? A. Risk for infection. B. Ineffective thermoregulation. C. Risk for injury. D. Chronic pain. Answer: C. Risk for injury. Rationale: patients with severe preeclampsia are at high risk for injury due to potential seizures, hypertensive crises, and complications such as placental abruption. Question 15. During a prenatal visit, a nurse is teaching a patient about the risk factors for preeclampsia. Which risk factor should be included? A. Advanced maternal age. B. Multiparity. C. Low body mass index. D. History of preterm labor. Answer A. Advanced maternal age. Rationale: advanced maternal age is a recognized risk factor for developing preeclampsia, along with other factors such as obesity and a history of preeclampsia. Question 16. What is the primary goal of magnesium sulfate therapy in a patient with preeclampsia? A. Lowering blood pressure. B. Reducing proteinuria. C. Preventing seizures. D. Enhancing fetal lung maturity. Answer: C. Preventing seizures. Rationale: the primary goal of magnesium sulfate therapy in preeclampsia is to prevent seizures. Question 17. A patient with preeclampsia is receiving an infusion of magnesium sulfate. Which finding should prompt the nurse to discontinue the infusion? A. Blood pressure of 140/90 mm of mercury. B. Respiratory rate of 10 breaths per minute. C. Urine output of 30 milliliters per hour. D. Absent deep tendon reflexes. Answer: B. Respiratory rate of 10 breaths per minute. Rationale: a respiratory rate below 12 breaths per minute indicates magnesium toxicity, necessitating the discontinuation of the infusion. A respiratory rate below 12 breaths per minute is an indication of magnesium toxicity, which requires immediate discontinuation of the infusion to prevent further respiratory depression and other serious complications. Option D, absent deep tendon reflexes, is also a significant sign of magnesium toxicity. It should also prompt discontinuation of the infusion. However, in the context of the NCLEX exam, respiratory depression is often considered a more immediate and severe sign of toxicity compared to absent deep tendon reflexes. Thus, both B and D could be correct in real clinical practice, but the emphasis on respiratory rate reflects a prioritization of immediate life-threatening issues for this question. Question 18. What is the most common fetal complication associated with preeclampsia? A. Macrosomia. B. Intrauterine growth restriction. C. Polyhydramnios. D. Neonatal jaundice. Answer: B. Intrauterine growth restriction. Rationale: intrauterine growth restriction is a common complication due to reduced placental perfusion in preeclampsia. Question 19. A nurse is planning care for a patient with severe preeclampsia. Which intervention should be included to minimize the risk of placental abruption? A. Encouraging frequent ambulation. B. Administering tocolytic medications. C. Maintaining bed rest in a lateral position. D. Performing daily weight checks. Answer: C. Maintaining bed rest in a lateral position. Rationale: bed rest in a lateral position helps reduce the risk of placental abruption by improving uteroplacental blood flow. Question 20. Which clinical finding differentiates severe preeclampsia from mild preeclampsia? A. Proteinuria. B. Hypertension. C. Epigastric pain. D. Peripheral edema. Answer: C. Epigastric pain. Rationale: epigastric pain is a sign of severe preeclampsia, indicating potential liver involvement and a higher risk of complications. Question 21. A patient at 30 weeks gestation is diagnosed with preeclampsia. Which assessment finding requires immediate intervention? A. 2+ pitting edema. B. Blood pressure of 150/90 mm of mercury. C. Proteinuria of 1+. D. Decreased fetal movement. Answer: D. Decreased fetal movement. Rationale: decreased fetal movement requires immediate intervention as it may indicate fetal distress or compromise. Question 22. A patient with preeclampsia is being prepared for labor induction. What is the primary reason for inducing labor in this condition? A. To reduce maternal anxiety. B. To prevent fetal macrosomia. C. To manage severe hypertension. D. To resolve the disease process. Answer, D. To resolve the disease process. Rationale: inducing labor is often necessary to resolve preeclampsia, as delivery is the only definitive cure for the condition. Question 23. A patient with eclampsia is receiving magnesium sulfate. Which of the following symptoms would indicate magnesium toxicity? A. Hyperreflexia. B. Oliguria. C. Diaphoresis. D. Tachycardia. Answer, B. Oliguria. Rationale: oliguria can indicate magnesium toxicity, as reduced kidney function can lead to accumulation of the medication. Question 24. During a routine prenatal visit, a nurse educates a patient on the signs of preeclampsia. Which symptom should the patient report immediately? A. Mild back pain. B. Persistent headache. C. Increased appetite. D. Nasal congestion. Answer, B. Persistent headache. Rationale: a persistent headache can be a sign of elevated blood pressure and cerebral edema, indicating preeclampsia. Question 25. A patient with preeclampsia is receiving intravenous labetalol. What is the primary goal of this medication therapy? A. Preventing seizures. B. Reducing proteinuria. C. Controlling hypertension. D. Inducing labor. Answer, C. Controlling hypertension. Rationale: the primary goal of labetalol therapy in preeclampsia is to control hypertension and prevent complications such as stroke. Question 26. Which of the following is a priority nursing intervention for a patient with preeclampsia experiencing visual disturbances? A. Assessing deep tendon reflexes. B. Administering antihypertensive medication. C. Increasing fluid intake. D. Providing darkened room environment. Answer, D. Providing darkened room environment. Rationale: visual disturbances may indicate cerebral involvement. A darkened room can help reduce sensory stimulation and prevent seizures. Question 27. A patient with severe preeclampsia is admitted to the intensive care unit. What nursing action is critical in this setting? A. Frequent assessment of urine protein. B. Continuous cardiac monitoring. C. Encouraging high-protein diet. D. Daily weight measurement. Answer, B. Continuous cardiac monitoring. Rationale: continuous cardiac monitoring is critical in severe preeclampsia to detect arrhythmias and other cardiovascular complications. Question 28. A patient with preeclampsia is undergoing labor induction. Which medication is commonly used for cervical ripening in this condition? A. Misoprostol. B. Oxytocin. C. Magnesium sulfate. D. Indomethacin. Answer, A. Misoprostol. Rationale: misoprostol is commonly used for cervical ripening to facilitate labor induction in patients with preeclampsia. Question 29. Which complication should the nurse monitor for in a patient with preeclampsia receiving magnesium sulfate therapy? A. Hyperkalemia. B. Respiratory depression. C. Hyperglycemia. D. Hypernatremia. Answer, B. Respiratory depression. Rationale: respiratory depression is a serious complication of magnesium sulfate therapy, indicating possible toxicity. Question 30. In a patient with preeclampsia, which finding on a fetal heart rate monitor would be most concerning? A. Early decelerations. B. Variable decelerations. C. Accelerations. D. Late decelerations. Answer, D. Late decelerations. Rationale: late decelerations indicate uteroplacental insufficiency, a serious concern in preeclampsia that can lead to fetal hypoxia. Question 31. A patient with preeclampsia is experiencing oliguria. What is the most likely cause of this symptom? A. Hypervolemia. B. Hypovolemia. C. Renal perfusion impairment. D. Increased glomerular filtration rate. Answer, C. Renal perfusion impairment. Rationale: oliguria in preeclampsia is typically due to impaired renal perfusion as a result of hypertension and endothelial damage. Question 32. A nurse is reviewing the lab results of a patient with severe preeclampsia. Which result would require immediate intervention? A. Hemoglobin of 11 grams per deciliter. B. Platelet count of 90,000. C. Serum creatinine of 1 mg per deciliter. D. Blood glucose of 80 mg per deciliter. Answer, B. Platelet count of 90,000. Rationale: a low platelet count indicates a risk for HELLP syndrome and warrants immediate intervention. Question 33. What is the primary purpose of administering corticosteroids to a patient with preeclampsia at 30 weeks gestation? A. To reduce maternal hypertension. B. To promote fetal lung maturity. C. To prevent seizures. D. To control proteinuria. Answer, B. To promote fetal lung maturity. Rationale: corticosteroids are administered to promote fetal lung maturity in preterm deliveries associated with preeclampsia. Question 34. Which assessment finding would indicate that a patient with preeclampsia is progressing to HELLP syndrome? A. Increased urine output. B. Jaundice. C. Decreased deep tendon reflexes. D. Tachycardia. Answer, B. Jaundice. Rationale: jaundice can indicate liver dysfunction, a component of HELLP syndrome, along with hemolysis and low platelet count. Question 35. A nurse is caring for a patient with preeclampsia on bed rest. Which intervention is most important to prevent complications related to immobility? A. Encouraging high fluid intake. B. Performing passive range of motion exercises. C. Administering stool softeners. D. Applying sequential compression devices. Answer, D. Applying sequential compression devices. Rationale: sequential compression devices help prevent deep vein thrombosis, a common complication of immobility in patients with preeclampsia. Question 36. A patient with severe preeclampsia has a blood pressure of 180/110 mm of mercury. What is the most appropriate initial intervention? A. Administering IV antihypertensive medication. B. Encouraging ambulation. C. Monitoring fetal heart rate. D. Starting oral antihypertensive medication. Answer, A. Administering IV antihypertensive medication. Rationale: IV antihypertensive medication is necessary for rapid blood pressure control in severe preeclampsia to prevent complications such as stroke. Question 37. Which of the following indicates a therapeutic effect of magnesium sulfate in a patient with preeclampsia? A. Blood pressure decrease. B. Decreased proteinuria. C. Absence of seizures. D. Increased urine output. Answer, C. Absence of seizures. Rationale: the primary therapeutic effect of magnesium sulfate in preeclampsia is the prevention of seizures. Question 38. A patient with preeclampsia has been prescribed labetalol. What is an important consideration for the nurse when administering this medication? A. Monitoring blood glucose levels. B. Checking for bradycardia. C. Assessing for signs of hyperkalemia. D. Evaluating liver function tests. Answer B. Checking for bradycardia. Rationale: labetalol can cause bradycardia, so it is important to monitor the patient's heart rate during administration. Question 39. A nurse is educating a patient with preeclampsia about potential postpartum complications. Which complication should be included in the teaching? A. Postpartum hemorrhage. B. Chronic hypertension. C. Urinary tract infection. D. Deep vein thrombosis. Answer B. Chronic hypertension. Rationale: patients with preeclampsia are at an increased risk for developing chronic hypertension postpartum. Question 40. Which intervention is most important when caring for a patient with severe preeclampsia on continuous magnesium sulfate infusion? A. Monitoring serum magnesium levels. B. Administering calcium supplements. C. Checking blood glucose levels. D. Performing hourly neurological assessments. Answer A. Monitoring serum magnesium levels. Rationale: monitoring serum magnesium levels is crucial to ensure therapeutic dosing and prevent toxicity. Question 41. A patient with eclampsia is being treated with magnesium sulfate. Which nursing assessment finding indicates the need to adjust the magnesium sulfate infusion? A. Patellar reflex 2+. B. Urine output of 25 milliliters per hour. C. Respiratory rate of 16 breaths per minute. D. Blood pressure of 140/90 millimeters of mercury. Answer B. Urine output of 25 milliliters per hour. Rationale: oliguria can lead to magnesium accumulation and toxicity, necessitating adjustment of the infusion. Question 42. What is the primary purpose of administering antihypertensive medication to a patient with preeclampsia? A. To reduce proteinuria. B. To improve renal perfusion. C. To prevent stroke. D. To manage pain. Answer C. To prevent stroke. Rationale: the primary purpose of antihypertensive medication in preeclampsia is to control severe hypertension and prevent stroke. Question 43. A nurse is caring for a patient with preeclampsia. Which finding suggests the development of eclampsia? A. Epigastric pain. B. Hematuria. C. Visual disturbances. D. Seizures. Answer D. Seizures. Rationale: the presence of seizures indicates that preeclampsia has progressed to eclampsia. Question 44. In a patient with preeclampsia, which fetal monitoring pattern is most concerning? A. Early decelerations. B. Accelerations. C. Sinusoidal pattern. D. Variable decelerations. Answer C. Sinusoidal pattern. Rationale: a sinusoidal pattern on fetal monitoring is highly concerning and can indicate severe fetal anemia or hypoxia. Question 45. A patient with preeclampsia is at risk for developing HELLP syndrome. Which lab result would be most indicative of this complication? A. Elevated bilirubin. B. Low hemoglobin. C. High platelet count. D. Decreased liver enzymes. Answer A. Elevated bilirubin. Rationale: elevated bilirubin is indicative of hemolysis, one of the components of HELLP syndrome. Question 46. Which nursing intervention is most appropriate for a patient with preeclampsia and a persistent headache? A. Administering analgesics. B. Elevating the head of the bed. C. Initiating seizure precautions. D. Encouraging fluid intake. Answer: C. Initiating seizure precautions. Rationale: a persistent headache in preeclampsia can indicate severe hypertension and cerebral involvement, necessitating seizure precautions. Question 47. A nurse is reviewing the medication orders for a patient with severe preeclampsia. Which order should the nurse question? A. Labetalol 20 mg IV. B. Magnesium sulfate 4 grams IV bolus. C. Furosemide 40 mg IV. D. Hydralazine 10 mg IV. Answer: C. Furosemide 40 mg IV. Rationale: diuretics like furosemide are generally not recommended in preeclampsia unless there is pulmonary edema, as they can reduce intravascular volume and worsen placental perfusion. Question 48. A patient with severe preeclampsia is being monitored for signs of organ dysfunction. Which finding would be most concerning? A. Blood pressure of 160 over 100 mm of mercury. B. Proteinuria of 3+. C. Platelet count of 100,000. D. Creatinine of 2.5 mg per deciliter. Answer: D. Creatinine of 2.5 mg per deciliter. Rationale: elevated creatinine indicates significant renal impairment, a serious concern in severe preeclampsia. Question 49. Which dietary modification is recommended for a patient with preeclampsia? A. Low sodium intake. B. High protein intake. C. Low carbohydrate intake. D. High fat intake. Answer: A. Low sodium intake. Rationale: reducing sodium intake can help manage hypertension in patients with preeclampsia. Question 50. A nurse is providing discharge teaching to a patient with preeclampsia. Which instruction is most important to include? A. Monitor blood pressure daily. B. Increase physical activity. C. Limit fluid intake to 1 liter per day. D. Take iron supplements. Answer: A. Monitor blood pressure daily. Rationale: monitoring blood pressure daily is crucial for early detection of worsening hypertension and timely intervention.